Hello, this is Dr. Hanume Gowda, a consultant orthopedic surgeon running AHA Ortho Care Clinic. Osteoporosis is weakening of the bone. Generally happens with a normal volume of the bone and the density of the bone is lesser. What is the difference between normal volume and density? Normal volume is the shape of the bone and the size of the bone is the same, but the content inside the bone is weaker. So this is what we call as osteoporosis. What happens in osteoporosis is, as the age advances, the density of the bone, that is the strength of the bone, starts coming down, but on the surface of it, the bone appears normal. So why these things happen? Why osteoporosis happens? Okay, the first part is the age itself will take a toll on the body. As the age advances, the body starts losing the bone weight, right? So this is one part of the problem. The other problem is how much of bone you put up as when you're young. So when you're young is the age of about 18 is where the peak volume for a woman is, and about 20 is the peak volume for man. So what is this peak volume? The bone starts aggregating from your birth date till around 18 to 20 years, that is according to male or female. After about that, the aggregation of bone, that is the bone strength accumulation, is much lower. So the peak volume is at about 18 in females and 20 in males. So that volume over age slowly starts decreasing, particularly after you cross the age of about 45 or 50. So in some cases, there are situations where you lose bone much earlier. That is, when your lifestyle is very sedentary, you are not very active physically, your bone volume starts decreasing earlier. Second thing is women attaining menopause earlier than their age. Normally, a woman attains menopause by the age of about 50, which is an average age for most of the women. Some people attain it much earlier, maybe 35 to 40 years. So once the menopause is attained, the hormonal changes happen in the women that leads to decrease in the bone strength. Estrogen is the hormone which is most important in a woman, which is very good and active till they are attaining their menstrual periods every month. Once the menstrual period stops, which we call as menopause, the estrogen levels in the body will go down, and accordingly the bone strength also will start going down. On an average, about 1% of bone is lost every year from the time of menopause till almost the time of death. So there are some people who lose bone faster, there are some people who lose bone slower. This all depends on their physical activity. Then we come back to the first part, which is 18 to 20 years we attain the peak bone volume, or it's also called peak bone mass. How do you attain peak bone mass? If you are very active in your younger age group, that is jumping, jogging, running, such activities which is outdoor and in the sun, you can attain more bone strength inside. If at all your activity is indoors, with less physical activity and more of sedentary activity, your bone accumulation is much lesser. So you always tend to have a peak bone mass which is at a much lower level. So this determines how your bone strength is when you are at the age of about 50 years. So this is what is osteoporosis all about.